While emergency hospitals serve an essential role in providing immediate medical care, their interaction with Indigenous communities, including the Noongar people, can present challenges. Due to cultural differences, historical mistreatment, and communication barriers, the fast-paced, Western-centric environment of emergency hospitals may unintentionally lead to detrimental outcomes for Noongar patients, particularly in the areas of medication prescribing and medical malpractice. This paper argues that emergency hospitals, without adequate cultural competency, risk causing harm to Noongar patients by undermining their health outcomes and perpetuating mistrust in the healthcare system. Cultural incompetency in prescribing medication. One significant issue is the potential lack of cultural understanding when prescribing medication to Noongar patients. Western medicine tends to approach treatment in a standardized, one-size-fits-all manner, which may conflict with Indigenous healing practices and beliefs. For the Noongar people, health is viewed holistically, encompassing not just physical well-being but also spiritual, emotional, and communal health. The rapid pace of emergency care often overlooks these holistic considerations. Overlooking traditional healing practices. Noongar patients may have reservations about certain medications due to traditional healing practices or cultural beliefs. In an emergency setting, doctors may prescribe medications without consulting or considering the patient's preference for traditional remedies. This can lead to a sense of disrespect or mistrust toward medical professionals, as the Western approach may seem dismissive of Noongar ways of healing. Lack of proper consultation. Due to time constraints in emergency settings, healthcare providers may not take the time to fully understand the Noongar patient's medical history, traditional treatments, or other underlying factors, such as adverse reactions to certain medications. Quick prescriptions without thorough consultation may result in harmful side effects or inappropriate treatments, especially when language barriers or a lack of cultural sensitivity impede clear communication. Overprescription and addiction risks. There is a documented concern regarding the overprescription of pain medications and psychotropics in Indigenous communities, which can exacerbate issues of dependency and addiction. In the high-pressure environment of an emergency hospital, where treating immediate symptoms is prioritized, Noongar patients may be prescribed strong painkillers or sedatives without consideration for their long-term health. This can lead to dependency, further disconnecting them from traditional healing practices and perpetuating a cycle of medical reliance. Risk of medical malpractice. Medical malpractice occurs when a healthcare provider fails to deliver appropriate care, causing harm to the patient. For Noongar people, the risk of malpractice in emergency hospitals can be heightened due to systemic issues such as racial bias, communication barriers, and misdiagnoses. Systemic bias and racial discrimination. Indigenous Australians, including the Noongar people, have historically faced racial bias in healthcare settings. Studies have shown that Indigenous patients are often treated with less urgency, are underdiagnosed, or are assumed to be under the influence of drugs or alcohol when seeking treatment. In an emergency hospital, where decisions are made quickly, this bias can lead to misdiagnosis, delayed treatment, or inappropriate care, all of which increase the risk of malpractice. Communication barriers. Language barriers and differing cultural expressions of pain or illness can lead to miscommunication between Noongar patients and emergency healthcare providers. For instance, a Noongar patient may downplay their symptoms or describe them in a way that a non-Indigenous doctor may not understand. If healthcare providers are not culturally trained to interpret these nuances, they may overlook serious health issues or misprescribe treatment, contributing to medical malpractice. Failure to provide informed consent. In an emergency setting, medical interventions may be performed without fully explaining the risks or implications to the patient, particularly if there are cultural or language barriers. For Noongar patients, this lack of informed consent can be a violation of their rights and dignity, further alienating them from the healthcare system. This not only opens the door for malpractice claims, but also erodes trust between Indigenous communities and the medical establishment. Historical and ongoing mistrust in healthcare. The mistreatment of Indigenous Australians by healthcare systems has deep historical roots, leading to a pervasive mistrust that persists today. For Noongar people, this mistrust is amplified in emergency settings, where the speed and depersonalization of care can exacerbate fears of discrimination and neglect. Historical trauma. The Noongar people, like many Indigenous groups in Australia, have experienced historical trauma through colonisation, forced removal from lands, and policies like the Stolen Generations. Many of these injustices were perpetuated or supported by government systems, including healthcare. This historical context makes Noongar patients particularly sensitive to dismissive or inadequate treatment in emergency hospitals. Reluctance to seek treatment. Due to past experiences of discrimination or substandard care, many Noongar people may be reluctant to seek medical treatment, especially in a high-stress, fast-paced environment like an emergency room. This reluctance can delay treatment and lead to worse health outcomes, as patients may wait until their condition becomes critical before seeking care. When they do seek care, they may already be skeptical of the treatment they will receive, creating a cycle of mistrust and inadequate medical attention. Exacerbation of health inequalities. Emergency hospitals are often ill-equipped to address the broader social determinants of health that disproportionately affect Noongar people, such as poverty, housing instability, and access to healthcare. When these systemic issues are not considered, the care provided in emergency hospitals can seem detached and ineffective, further entrenching health inequalities between Indigenous and non-Indigenous Australians. Culturally competent care as a solution. To mitigate the detrimental effects of emergency hospital care on Noongar people, healthcare institutions must adopt culturally competent practices. This involves training staff in Noongar cultural sensitivities, employing Indigenous healthcare workers, and integrating traditional healing practices into the medical care framework. By doing so, hospitals can provide care that respects Noongar beliefs and practices, while also ensuring that treatment is safe and effective. Cultural awareness training. Emergency hospital staff should be trained to recognize and respect Noongar cultural practices, beliefs, and expressions of health. This training should include how to engage with Noongar patients in a way that builds trust and ensures clear communication, even in high-pressure situations. Inclusion of Indigenous healthcare workers. Employing Indigenous liaison officers and healthcare professionals who understand the Noongar language and culture can help bridge the gap between Noongar patients and Western medical systems. These workers can act as advocates for Noongar patients, ensuring that their cultural needs are met and that they feel respected throughout the treatment process. Integration of traditional medicine. Where appropriate, traditional Noongar healing practices should be integrated into the care provided by emergency hospitals. This can involve working with Indigenous healers, recognizing the value of bush medicine, and providing spaces for culturally appropriate care. By respecting these practices, hospitals can offer a more holistic form of treatment that aligns with Noongar values. Conclusion. Emergency hospitals, while essential for immediate medical care, pose significant risks to Noongar people when cultural differences are not accounted for. The rapid prescribing of medication without consideration for traditional healing practices, combined with the potential for racial bias and miscommunication, increases the likelihood of medical malpractice. To address these issues, hospitals must prioritize culturally competent care, ensuring that Noongar patients receive respectful, safe, and effective treatment. By doing so, they can begin to rebuild trust with Indigenous communities and reduce the harmful impacts of Western healthcare systems.